Welcome to part 2 of 3 of English for Health. These videos have been produced to support those who don't have English as a first language to better understand healthcare in the UK and the NHS. This video is about using GP services. A GP practice includes doctors and nurses. Before we start, let's learn some useful words. Pause each word to read the description. Patient. Receptionist. Appointment, also called a consultation. GP, also called a doctor. Prescription. Interpreter. Urgent. COVID restrictions have now been lifted in the UK, but some GPs and other healthcare services may request that you wear a face mask. It is important to take sensible precautions against COVID, especially if you class yourself as being in a vulnerable category. This might include using telephone or online appointments where these are available. If you think you have COVID symptoms, phone NHS 111 or visit the link on screen before doing anything else. Okay, let's get started. What exactly is a GP? They are highly trained doctors who can treat anyone, and they are free to use. A GP is able to help with physical, mental, and social aspects of health. A GP can help in a lot of ways. They may give you a prescription for medication, take blood samples, make specialist appointments for you, or refer you to a hospital. Before you can see a GP, you will need to register at a practice, sometimes called a surgery. There will usually be a few near your home, and you can choose which one you want to register with. To register, you can go to the practice and ask for a receptionist for a registration form. Or you can register on the practice website. You might be asked for ID, but don't worry if you can't show anything, you will still be able to register. Further guidance about registering with your GP can be found using the link on screen. Now you're registered, you'll need to make an appointment to see the GP. You can make an appointment by speaking to a receptionist in person or on the phone. Some GPs let you do it on the internet too. When speaking to the receptionist, they will decide who you need to see and what type of appointment would be best: telephone, face-to-face, or online. If you have a preference, let them know. You can ask for a receptionist for a male or female GP if you prefer. If you need help with speaking English, say interpreter to the receptionist, and then the language that you speak. This is a free service. The interpreter will be at your appointment and help translate for you. Interpreters work for the NHS. They will keep your conversation with the GP private. If you need an interpreter, always use one provided by the NHS, not a friend or family member. Now you've booked an appointment, what happens next? You should arrive 5 minutes before your appointment time. Tell the receptionist your name and your appointment time, and they will tell you where to wait. When the GP is ready, they will call your name. Sometimes they will show your name on a TV or electronic display, so pay attention. When called, you can see the GP and tell them the problem. An appointment usually lasts for 10 minutes. Some people like to take a list of questions they have for the GP so they don't forget. You should try not to miss an appointment, as this can waste the GP's time. If you arrive late for your appointment, it may be cancelled and you will have to make a new one. If you know you'll miss the appointment, tell the receptionist as soon as possible. This saves time and means someone else can see the GP instead. That's the end of Module 2. Let's look at some questions and see how much you remember. Pause the video after each question and press play when you have an answer ready. Imagine you have a headache. Pause the video here and think about how you would answer these questions. Now, imagine you have blurry eyes. Pause the video here and think about how you would answer these questions. True or false? A GP can give you a prescription for medication. True. True or false? A GP can't make you an appointment with a specialist. False. True or false? You must arrive 5 minutes early for your appointment. True. True or false? If you need an interpreter, you will need to pay. False. True or false? A GP appointment is about 10 minutes long. True. True or false? If you cannot go to your appointment, you must cancel it. True. That's the end of Module 2. Thanks for watching.